University of Washington is a very large state-supported university here in Seattle, Washington. We have a large campus located on the shores of Lake Washington that's comprised of the traditional liberal arts and sciences, as well as our health sciences campus that has 6 schools. We collaborate with UW-Medicine, which is comprised of 4 hospitals in the area, the School of Medicine and Airlift Northwest.
There are nearly 800,000 strokes that happen every year in the United States, and it's currently the 4th leading cause of death in our country.
The Living Well with Strokes study is a psychosocial behavioral intervention for individuals who have had a stroke and have depression following the stroke. The prevalence of depression in the general population, the figures vary, but about 16–17%. The prevalence of depression in stroke survivors is considerably higher, probably about a third.
I really appreciate you taking the time to talk to me.
We've
been doing clinical trials in which we're testing very brief counseling intervention in addition to antidepressants. And we're now in the second phase of those studies in which we're comparing doing this treatment in person compared to telephone.
The research nurses have different roles. All of them do the screening, so they would go out to the various hospitals recruiting to identify individuals who might be candidates for the study. We have the one therapist who does the intervention, so that is sometimes done by telephone here, it's sometimes done by going to their home, and then the nurses do the follow-up. So again, some of those are done by phone, but a lot of it is going out to the individual's home. And I think that's really been critical in keeping people in the study for a year.
We have a very high retention rate, 90%, which is pretty unheard of. And we think that is primarily due to the fact that patients are getting some benefit of the interaction of study nurses going into their home and working with them with regard to maybe reviewing stroke prevention, clarifying medications, and troubleshooting any potential medical problems where we may refer them to their primary care provider for follow-up. We're hoping to show that delivering the intervention by telephone works equally as well as in person. So we're very hopeful with perhaps finding some positive outcomes.
I had a small stroke and was at Virginia Mason Hospital, and the nurse there asked me if I wanted to take part in the study. She said that the university was doing this study that might be helpful to people. I think being involved in the study made me kind of focus on, you know, the important things in life as far as like taking each day as it comes, but also trying to get involved in fun activities and not just focus on, you know, working all the time. And
come here, bring your baby.
It's been about 1.5 years now since my stroke, and you know, health-wise, I'm doing really good. So.
One of the wonderful things about working at the University of Washington is having amazingly talented colleagues with whom to work. And this study really highlights that. It's involving the School of Nursing, the School of Medicine, the departments of neurology and psychiatry, genetics. So it's bringing together a very large pool of individuals who normally don't work together to address this very important problem. The Stroke Center here at the University of Washington has been in existence for many years. Our goal is really to provide the best stroke care we can for our patients. I am a clinician scientist, and I do basic science research as well as clinical research, and I think I really do span that translational gap. And my research focuses on the immune response following stroke and how that contributes to brain injury.
My role in the Living Well with Stroke study is to analyze genetic variants in stroke survivors with or without depression. We are looking at which genetic variants predispose people to develop depression after stroke and which genetic variants interact with their response to treatment. The results of our just completed work could help target patients to one intervention versus the other, medication versus psychotherapy.
The study is benefiting people by helping to reduce depression to levels that are no longer considered clinical depression. It also helps people by giving them some insights into how their behaviors their ways of dealing with everyday life are linked to their mood and to their depression. Many people have said that it's really changed the way that they approach the everyday difficulties of life by having participated in this study.